The migraine-specific drugs absolutely can have life-changing characteristics to them. I can speak to that myself. I use Maxalt, and the reason I use it is because it allows me to go on with my work and see patients and not have side effects. So, I'm certainly not falling asleep in front of them, and, we can carry on a conversation, and I think I'm reasonably, lucid. But it works, and that's the bottom line. It takes the headache away.
Shannon still gets migraine headaches, but instead of disabling her for days at a time, they are now manageable.
A lot of times it does help, and you can, instead of ending up on the bathroom floor, you can muddle your way through the day and at least make it, even if it's halfway, you can make it part of the way. Sometimes you can't, and sometimes your coworkers have to drive you home, which is very, very nice, but most of the times you can make it through the day. And that's a wonderful, wonderful improvement. That really, really is.
We're back with Suzanne Simons, who is the Executive Director of the National Headache Foundation. Now, Suzanne, if we're having problems with migraines, what should we do? What kind of advice do you have for us?
Well, the first thing is to make an appointment specifically for your headache problem with your healthcare provider. So many times women tack on their, oh, by the way, I'm suffering from these headaches, to another visit, and the doctor doesn't recognize the impact that these headaches have in someone's life. So it's important that when you go to see your healthcare provider, you take a headache diary with you. And the headache diary covers many things, like how long you've had your headaches, the location of the pain, the duration, the frequency, the intensity, what you ate before you had your headache. And the headache diary, along with a complete medical exam, is the best way to diagnose migraine.
And that can help your physician kind of understand where it may be coming from or what the triggers are, possibly.
Absolutely. The triggers can be everything from colognes and perfumes, different types of foods you may eat, getting too much or too little sleep. So it's important to know what your triggers are so that as best you can avoid them.
So other than understanding triggers, if that's possible, a healthy lifestyle, are there therapies or medications that can also help with migraines?
Well, that's the good news, is that migraine is in fact a treatable disease. And there are a couple of types of medications. There are acute medications, and those are medications that you take when you get your headache. And they include things like the triptans, and currently there are 7 of them on the market. There are NSAIDs, non-steroidal anti-inflammatories. There's dihydroergotamine. And then there are other types of pain-killing therapies which tend to be used less frequently because really you want to treat the mechanism of the migraine rather than just treat the symptoms. There are also prophylactic or preventive medications, and those you take every single day whether or not you have the headache. And they include things like beta blockers, calcium channel blockers, anti-seizure medications, antidepressants. So it's really important when you go in to talk to your healthcare provider that you understand what those categories are. And there are also other non-medicated ways that people will use to treat their headache. And sometimes it's a combination of things. So it's important that you get in, make that appointment specifically for your headache so that your healthcare provider can help you design the program that's right for you.
Well, we're now going to meet a woman who has taken control of her debilitating migraines by combining the therapies and the medications. Let's take a look. This is Paula Kuntz's favorite walk, along the waterfront near her home in West Seattle, Washington. It's taken a long time to get to this point, where she doesn't have that dreadful feeling in the back of her mind that a migraine headache could attack at any moment and take her away from this lovely scenery, locking her in a dark, painful place for days at a time.
I really don't remember exactly when I had my first migraine, but it was about when I was 13, and I noticed that I became very sensitive to lights and very sensitive to sounds, and they really were debilitating back then. My father had migraines, and they are, as we know, they're mostly hereditary. So my father had migraines, and my one older sister had migraines.
At age 16, she was having so many migraines that her parents took her to a neurologist who tested her for brain tumors.
They put me in the hospital over winter break, and they did an encephalogram, which I don't think they even do nowadays. My physicians are always horrified when I tell them that I had that done. It's basically where it's considered major surgery. They put you under. totally under, and they shoot air into your spinal cord, and then they watch how long it takes for the air to dissolve in your brain.
She began taking huge numbers of over-the-counter pain pills and eventually developed an ulcer.
I tried everything. My dad had kind of a massage therapist that would work on his neck when he got, and really work on those neck muscles, and that's what I would have done. Later, when biofeedback came out, I had a biofeedback machine where I could, lower my heart rate and my blood pressure and try to, calm. And so it was. I didn't talk about my migraines a lot. I just dealt with them. I didn't talk because everybody was like, oh, "What are you worried about?" or "Oh, what are you stressed out about?" It's like, "Well, you should do this. You should do that. You shouldn't do this. You're too uptight. You're too much of a type A." And it was really hard because it was my fault that I had the migraines.
Dr. Jan Brandis is a neurologist at the National Neuroscience Group in Nashville, Tennessee. At this clinic, she diagnoses and designs treatment programs for people suffering from headaches. Her group also runs a number of studies to help develop new drugs to prevent and treat migraines.
The drug class that really has revolutionized the treatment for migraine is that of the triptans. And the first triptan was introduced in 1993 as an injectable formulation. And over the next 15 or so years, we now have 7 triptans, and we have injectable, nasal spray forms. There are some that melt on the tongue, and then there are some that are swallowed as conventional tablets. So we now have 7 drugs in that class from which to choose. And the triptans, if they are correctly chosen for an individual migraineur and the patient treats early in the attack, those medications, again, in many patients can result in completely being migraine-free, not just headache-free, but migraine-free, because they will often help the light and sound sensitivity, the nausea that's associated with migraine. So patients really have the opportunity, again, with the right drug and the right timing, to get migraine-free in 30 minutes to an hour.
I very, very rarely get sick, and it's sick where I am down for the count.
Paula still gets 4 or 5 migraines a month, but she can handle them with her new medication.
For the majority of the people, it's really saved my life. I don't have to deal with that pain all the time. My life is normal, and I have no side effects. You don't feel drugged out. You just go on with your life, and it's great.
We're back with Suzanne Simons. Now, Suzanne, I'd like to know a little bit more in detail why it is that women are more affected more often than men when it comes to migraines.
Well, it's the hormonal fluctuations. So women experience those with their monthly menstrual cycle. In fact, 60 to 70% of women say that they have a headache with their period. So we do recognize that it's the drop-off in estrogen that may trigger this. Mm-hmm. And sometimes these headaches occur immediately before, during, or after the menstrual cycle. And there are ways to effectively treat a menstrually related migraine. The other type of headache that may occur is a headache that comes with menopause. Some women have never had headaches before. They start their menopause cycle and suddenly develop headaches. For other women, menopause actually has an effect where they don't have their headaches any longer. But if you've never had a headache before and you suddenly develop them, it's really important to see your healthcare provider, or if your existing headache pattern changes, see your healthcare provider then. And the other thing that happens, too, is that a lot of times women are on oral contraceptives.
Right.
And what we recognize is that for some women, those oral contraceptives can be a little bit protective in that they help to sort of regulate the hormonal fluctuations, that it's a more steady stream of estrogen. Mm-hmm. And so they don't have headaches as frequently. For other women, it can, in fact, cause more headaches. So see your healthcare provider.
Well,